So my name is Julie McGregor. I currently work at the University of North Carolina, Chapel Hill in our glomerulonephritis and vasculitis clinic. We are with the UNC Kidney Center. So I'm an assistant professor, I'm a nephrologist at UNC. I originally did medical school at Wake Forest University and then residency at University of North Carolina. Ended up doing renal fellowship for 2 years clinical in UNC, and then did an additional year of glomerulonephritis and vasculitis fellowship under Dr. Ronald Falk and Dr. Patrick Nachman. I am doing research in ANCA vasculitis primarily through the Glomerular Disease Collaborative Network. And we do multiple studies on treatments and complications of treatments, epidemiological studies. I also do translational research with our basic science lab and see multiple vasculitis patients and enroll them in our registry. My interest here is with complementary and alternative medicine as well as nutrition. I am here to speak a little bit about my hobbies and interests with numerous integrative medical approaches. I did 1 month with the program on integrative medicine at University of Arizona when I was a resident. And then I have studied at UNC on complementary and alternative medicine at their college course and health sciences course on complementary and alternative medicine. And I have participated in the mind-body skills group at UNC as well. So I'm here to speak about CAM with you. Well, I actually think I ended up being a nephrologist because I love nephrologists. They are great people, and especially at the University of North Carolina, some fantastic personalities, great people to work with. But I was drawn to vasculitis and glomerulonephritis early in my residency training, and I just really wanted to work with this patient population. I am different than many nephrologists. I don't spend as much time working on the specifics of fluid and electrolyte balance. I do spend a lot of time working with vasculitis patients and other vascular patients. So it's a nephrologist who has sort of a rheumatology bent, which I like. Well, there are patients who will have vasculitis only in their kidneys, and so oftentimes nephrologists are the first doctors to diagnose vasculitis in some instances. There are instances where patients are referred to us from rheumatology or pulmonary or ear, nose, and throat because hematuria or blood in the urine is noticed in addition to other vasculitis symptoms, and they want us to work with patients who already have known disease. So it can be either way. But nephrologists do spend a lot of time working with kidney manifestations of vasculitis, whether it's newly diagnosed or after a long time. We try to get patients into remission before transplanting their kidney. Patients who have vasculitis and then have a kidney transplant usually do very well. But our preference is that even if the ANCA titers are still positive, that the person clinically be in remission before getting transplant. Well, complementary medicine and alternative medicine have been combined before in a term of complementary and alternative medicine. Alternative medicine has the stigma of being instead of a allopathic or Western or more traditional, at least in our culture, traditional approach. Complementary medicine is a term that has meant to be used in addition to a more Western or allopathic medical approach. Now, many people use the term integrative medicine if they're discussing alternative medical techniques that are used alongside with allopathic medicine. Well, you know, I believe that it's important, at least with what information we have now, to trust the allopathic approach to active disease, and that when patients have active component of vasculitis, to not deny therapies that have been shown in the literature to be effective for controlling the disease. But I do think that there are alternative approaches that are either Eastern medicine based or mind-body medical approaches that can assist with keeping people in remission and even getting people into remission sooner. And I've been asked in the past, can alternative medicine approaches keep relapses at bay even off of remission maintenance therapy? And I've seen that happen, but in all instances of active vasculitis, I think it's very important to trust the allopathic approaches that we've seen proven in the literature to be of benefit. Well, I believe that nutrition approaches, using an anti-inflammatory diet, trying to limit animal-based proteins, increase anti-inflammatory foods such as the omega-3 fatty acids, can help keep people in remission and can allow for reduction in remission maintenance therapies. Yoga and mind-body based approaches, including Qigong, Tai Chi, mindfulness-based stress reduction, all of these approaches can help limit stress, and stress can be a trigger for relapse. And they can also help keep the body feeling fit and improve a sense of wellness. This can really help to stave off remissions. I think a lot of triggers with either nutrition or stress can be addressed with alternative approaches and can prevent the need for long-term toxic immunosuppressive therapies. Well, I mean, I was trained under Dr. Ronald Falk and Patrick Nachman, and they laugh at me all the time. They don't believe in any of this. They think I'm out in left field, which is fine. I mean, I think there's going to be some patients who resonate with this as a truth for them, and some doctors who resonate with this as being truth, and then others who prefer to say that this is not for them. And I think that that's okay. I would definitely not say that these approaches are widely accepted, but I think there's definitely a role, and I'm a big believer. You have to only be dealing with practitioners who are trustworthy, and that you have had word of mouth recommendation as being really effective practitioners in any sort of alternative therapy, especially with herbals. Well, I've actually been recently, over the past year, exposed to aromatherapy, which has been very effective. I have found for insomnia, for increasing vitality, for pain, even just relaxation and reducing stress response. Aromatherapy is a really excellent product, and one doesn't actually have to have a sense of smell to even benefit from aromatherapy, and I know that can be a major issue, especially for patients with granulomatosis with polyangiitis, but aromatherapy can be effective. I think yoga, Tai Chi, Qigong are incredibly beneficial for pain, as well as just keeping a good energy in the body, and that usually can help patients reduce their medications because there's a reduced stress, reduced inflammation in the body with these mind-body therapies. Meditation, journaling, and breathing techniques are also things that can be used for reducing stress response and can be extremely beneficial in lowering other remission maintenance medications because there's an assistance of the whole mind-body approach that allows for therapies such as prednisone and Imuran and methotrexate to be reduced in many patients' cases. I mean, obviously not in everybody's case, and I don't think that patients should go out and just start doing yoga and to stop their prednisone right away. That's not at all what I'm saying. But people who can increase their overall mind and body and spiritual health and wellness often find that they can reduce some of the medications that they've been on for remission maintenance. Fantastic. I think journaling is a wonderful skill. If one can journal every day, even for just 5 or 10 minutes, it helps to relieve stress. It is a way that you can vent and not feel guilty about it and not feel like you're burdening others. It also allows people to have record keeping, and interestingly, some patients try to do elimination diets where they reduce the sugar in their diets, reduce the gluten in their diets. And if you're journaling every day how you're feeling on these elimination diets, then when you add back whatever substance you've eliminated and you keep journaling, you can tell if there's a difference in how you've been doing before or after certain interventions. I also think that journaling is just a really major release that people find therapeutic, whether they're going through a divorce or having a severe disease or just on a daily basis wanting to keep mental stability. Journaling's great. Well, I think one of the things that makes vasculitis so hard is it feels like it's so out of control. It feels like the disease is bigger than you almost, and then you go to a physician and the physician says you need to do this X, Y, and Z, and those therapies that you're put on are so toxic and difficult to your body. What's possible with some of these alternative approaches is to gain a sense of control back and feel like that you can start to make choices that are in your best interest, whether that be nutritional changes or starting a mind-body practice that helps to improve your life, reduce your stress, and help you feel more vital. I do believe that for vasculitis patients, you can get back your life and get back your sense of wellness. And that's why I love these more whole body approaches to the healing process, especially for vasculitis. And certainly using foods that are healthy, organic, raw materials, good real foods can help with energy. Listening to your body and sleeping when you're tired is very important, and not feeling like you should have more energy, you should do more for others, but instead listening, well, where is my energy level, and responding to that and resting when you need to rest. That actually ends up increasing vitality. Exercising at all, 30 minutes a day, can help if you have the ability. Doing some form of exercise can help with energy. And stretching, whether or not you want to embark upon yoga at all, but just doing some form of stretching of the muscles just helps to make your whole body feel more alive. Again, I do think aromatherapy is beneficial, and I think finding clarity of mind can help with your energy and your sense of wellness and vitality, and meditation can help with that, breathing techniques, deep breathing techniques, and journaling. Well, what's fantastic about this organization and this symposium is getting people together to talk about what's important to patients, and hearing from patients what they want us as researchers to work on, and for patients together to come and feel like they're not alone, they're not on an island, but in fact that there are others going through this type of process, and find out from them, well, what's working for you. Just in my experience over the past 2 days, I've heard from many different people about interventions, both from nutritional and complementary components that I've never heard of, I've never worked with, but really worked for them, and now I can pass that on to some of my other patients, and some of the patients in our groups have learned from that, and it's just so nice to learn from each other as patients.